About 20 million people in the U.S. can now line up for coronavirus booster shots. CDC Director Dr. Shale Wong signed off on third doses of Pfizer's vaccine. She also issued a reminder that we can't, quote, boost our way out of this pandemic, adding that the most vulnerable people are the unvaccinated. So far, more than 55% of the population is fully vaccinated. Just over 64% has received at least one dose. Omar Villafranca leads off our coronavirus coverage from Dallas.
I will talk with you about vaccine booster shots.
Early this morning, CDC Director Shale Wong expanded who is now eligible for a Pfizer booster shot, overruling one of the recommendations from her agency's advisory panel.
In a pandemic, we most often take steps with the intention to do the greatest good, even in an uncertain environment. And that is what I'm doing with these recommendations.
Her decision now aligns the CDC and FDA guidelines, saying anyone 65 and older who has been fully vaccinated with the shot should get a booster after at least 6 months. It also recommends a booster for fully vaccinated people 18 through 64 who work in healthcare or other jobs with an increased risk of exposure to COVID, like schools and nursing homes. Vaccinated people 18 to 64 with medical conditions putting them at high risk for severe COVID, like obesity, diabetes, or pregnancy, are also eligible for a booster.
As of today, up to 20 million Americans can get their booster shot.
But at a White House coronavirus task force meeting today, Walensky said vaccinating the unvaccinated remains a top priority.
I want to be clear. We will not boost our way out of this pandemic.
Brown University's Dr. Ashish Jha.
Boosters are an important component of keeping people who are already vaccinated safe, but the biggest strategy has to be getting the unvaccinated their first shot.
Earlier today, President Biden, who is 78, said he would be getting his own booster soon.
It's hard to acknowledge I'm over 65, but I'll be getting my booster shot.
A short time later on ABC's The View,
I need the two of you to step off for a second.
Co-hosts Sunny Hostin and Anna Navarro abruptly left the set just before interviewing Vice President Harris. They had just tested positive.
And they'll be okay, I'm sure, because they're both vaccinated.
Scientists say one of the keys to ending the pandemic is protecting children. Today, the CDC pointed to new data that showed schools without mask requirements were 3.5 times more likely to have outbreaks. Today, at the annual Texas State Fair, Edward Bennett, 77, was among the first to receive his booster.
As soon as I heard about the boosters, the only thing I wanted to know is where can I get it?
The Texas State Fair, which opens today, is offering boosters as well as first and second shots. They've already given out 75 already, but they're prepared to offer 500 a day at this 3-week-long event. Lana?
Love first, second, and boosters there. Omar, thank you. For more, I want to bring in Dr. Shale Wong. She's a professor of pediatrics and the executive director of the Farley Health Policy Center at the University of Colorado. So, the head of the CDC has given that green light to booster shots for millions of Americans, including healthcare workers and others who have a high risk of exposure. But that particular recommendation was not supported by an advisory panel on Thursday. Why might the panel have voted against that recommendation, and what do you make of the agency's final decision?
Well, first, I'd like to say thank you for having me today. I think that there is news that is coming in rapidly, and we are trying to just stay on top of all of it. I have the greatest respect for our agencies who are really studying the science and trying to offer these recommendations. So I think it's fantastic that we have clear recommendations now about those populations that can get their vaccine. And being one of those docs that's on the front line to offer the vaccines, we know who we can give them to now.
So officials say that they're going to be relying on an honor system for this rollout, and President Biden is urging people to, quote, wait their turn. But it's also not just about taking turns. Explain to all of us why it's important for people to actually wait those 6 months before getting a third dose.
Well, as your story presented leading into this, really, we have 70 million people who have not yet received their first vaccine. And so it is really a high priority that we try to get as many people vaccinated as possible. These vaccines work. We know that they are very effective at reducing severe illness, preventing hospitalization and death. And so we need as many people as possible to get their vaccines. And if they have questions about it still, whether or not to get a vaccine, talk to your primary care docs. That's what they're there for. They want to help answer these questions and get through some of the confusion. But those who are eligible to get their vaccines now should go ahead and do so, and that will help keep all of us safe.
But let me ask a clarifying question, Dr. Wong. If you're in a high-risk group and gotten a vaccine 6 months ago, but it wasn't Pfizer initially, can you get this booster?
At this point, this is recommendation only for those who have received the Pfizer vaccines. So this will be a third dose of Pfizer vaccine. And in short order here, we will have more information about Moderna and Johnson & Johnson, who have also submitted their data to the FDA so that we can get approval and review for when they will actually be getting the boosters.
And on Friday, Dr. Walensky said, as you heard, we will not boost our way out of this pandemic. Just over 55% of the population has gotten their first 2 doses. You emphasized how important it is, and all healthcare providers are saying that the first and second doses are far more important, really, than the booster shots. But how do you think that the booster rollout might impact initial vaccinations in a positive, negative, or it won't affect it at all?
You know, it's hard for me to say that. I really just know what I'm seeing in my own practice. And as a pediatrician, we are eager to see those first vaccines available to our kids, 5 to 12. We've been administering vaccines to kids 16 and above. And we are just doing our best to have those conversations with folks and let them know that vaccines are available and that their primary care physicians are there to serve them.
So we have plenty of first and second doses of vaccines available for our population here in the U.S., but Reuters reports that there are more than a dozen countries around the globe that have yet to get even 3% of their population a first dose. Dr. Wong, do you think that we're doing enough to fight the global pandemic?
Well, I could say that we were pleased to see the administration come forward earlier this week and say that they would commit another 500 million doses to the global need. And it is an incredible challenge when we need somewhere between 6 and 9 billion more vaccines worldwide. The vaccine development is happening as quickly as possible. And so I do believe that there is capacity to continue to produce enough vaccine to both provide our boosters here and also to ship them overseas.
All right. Dr. Shale Wong, thank you for joining me, and thank you for all that you do.
Thank you.